Welcome. Today we're diving deep into the world of digestive health to explore a chronic condition called ulcerative colitis. This inflammatory bowel disease, or IBD, can significantly impact a person's life, so let's unravel what it is, how it affects the body, and what can be done about it. While the exact cause of ulcerative colitis remains a mystery, it's believed to be a complex interplay of factors. Genetics play a role, as individuals with a family history of IBD are at a higher risk. Environmental triggers, such as certain infections or medications, may also contribute. The prevailing theory suggests that in individuals with a genetic predisposition, an abnormal immune response to gut bacteria leads to chronic inflammation in the colon. Ulcerative colitis is characterized by chronic inflammation and ulceration of the innermost lining of the colon and rectum, known as the mucosa and submucosa. This inflammation results in the breakdown of the epithelial barrier, leading to ulcers and erosions. The affected areas become inflamed, swollen, and bleed easily. The body's attempt to repair the damage can lead to scarring and narrowing of the colon over time, further disrupting its normal function. Ulcerative colitis is a global disease, but its prevalence varies across different populations. It's more common in Western countries, particularly in North America and Europe. It affects both men and women equally, and while it can occur at any age, it's most frequently diagnosed between the ages of 15 and 30. The incidence is also slightly higher in individuals of Jewish descent. The symptoms of ulcerative colitis can vary in severity, depending on the extent and location of the inflammation. Common symptoms include frequent diarrhea, often with blood or pus. Abdominal pain and cramping are also typical. Many experience a persistent urge to have bowel movements, known as tenesmus. Other symptoms may include fatigue, weight loss, fever, and anemia due to chronic blood loss. Some may experience extraintestinal manifestations, affecting other parts of the body, such as joint pain, skin rashes, or eye inflammation. Diagnosing ulcerative colitis involves a combination of medical history, physical examination, and diagnostic tests. A colonoscopy with biopsy is the gold standard for diagnosis. During a colonoscopy, a flexible tube with a camera is inserted into the rectum to visualize the colon and obtain tissue samples for microscopic examination. Blood tests can help detect inflammation and anemia. Stool tests can rule out other causes of diarrhea, such as infections. Imaging techniques, such as X-rays or CT scans, may be used to assess the extent of the disease and rule out complications. Ulcerative colitis is classified based on the extent of the inflammation in the colon. Proctitis involves inflammation only in the rectum. Proctosigmoiditis affects the rectum and sigmoid colon. Left-sided colitis extends from the rectum to the splenic flexure, which is a bend in the colon. Extensive colitis, or pancolitis, involves the entire colon. The classification helps guide treatment decisions and predict the potential for complications. The primary goal of treatment is to reduce inflammation, relieve symptoms, and prevent complications. Medications are the cornerstone of treatment. Aminosalicylates such as mesalamine are often the first-line therapy for mild to moderate disease. Corticosteroids, like prednisone, are used to quickly reduce inflammation during flare-ups. Immunomodulators such as azathioprine or 6-mercaptopurine help suppress the immune system and maintain remission. Biologic therapies, such as anti-TNF agents or anti-integrins, target specific components of the immune system and are used for more severe or refractory cases. In severe cases or when medical therapy fails, surgery may be necessary. The most common surgical procedure is a proctocolectomy with ileal pouch and anastomosis, or IPA, in which the entire colon and rectum are removed, and a pouch is created from the small intestine to allow for bowel continence. Currently, there's no known way to definitively prevent ulcerative colitis. However, adopting a healthy lifestyle, including a balanced diet, regular exercise, and stress management techniques, may help reduce the risk or severity of flare-ups. Avoiding smoking is crucial, as it's been linked to a higher risk of developing ulcerative colitis and experiencing more severe symptoms. The prognosis for ulcerative colitis varies depending on the severity and extent of the disease, as well as the individual's response to treatment. Many people can achieve and maintain remission with appropriate medical management. However, some may experience chronic symptoms or require surgery. Recent research focuses on developing more targeted therapies, identifying biomarkers to predict disease course, and understanding the role of the gut microbiome in ulcerative colitis. Studies are also exploring novel approaches, such as fecal microbiota transplantation, to restore a healthy gut environment. Ongoing research offers hope for improved treatments and ultimately, a cure for this challenging condition.